All right, it's an issue that is not often discussed. It's kind of a difficult topic at times, but this week is Eating Disorder Awareness Week.
We asked Dr. Cedrek McFadden, Dr. C, to join us here today to help us better understand the cause of these disorders and what we can do to try to help out. Dr. C, thanks for coming in.
Thanks for having me again.
So let's start off with, how do you know when it could be an eating disorder, not just maybe a diet or just weird eating habits?
So many folks are on a diet. We've talked about lots of them just on this show alone. But diet should not negatively impact your health. It should not negatively impact your mental health or physical health. Diet should not negatively impact your work and your school and your relationships. And when we think about dieting to lose weight, most of us have a goal in mind. Perhaps it's a certain weight your doctor told you should be at. Perhaps it's a certain dress or a piece of clothing you like to wear. There's an end goal to it. Eating disorders, there's no end goal. It's just this never-ending cycle that becomes vicious at some point.
What are some of the early signs? So if you're a parent, for example, and you're kind of suspicious that something may not be right with what's happening with your young person or even an adult child, what do you do to detect this?
So looking at the obvious, first of all, what are the obvious visual changes? Has there been drastic weight loss? Have there been mood disorders or mood changes? Or perhaps the patient or the person that you're concerned about has become more of a recluse, not wanting to go out to dinner with family and friends, or being very secretive about their eating habits. Paying attention to all of that may help you identify if there's a problem present.
There are some extreme examples of eating disorders, but the first two we think of are anorexia and bulimia.
And bulimia, yes.
And bulimia. So are we seeing an increase in eating disorders being diagnosed now because there's a raised awareness, and also I just think social media could be playing into it as well?
Well, one age that we perhaps are seeing that are in children. As young as 7 to 8 years old. They're picking up on some of these habits, and these are habits that you can get treated from, you can fully recover from, but it takes a team approach of medical providers, mental health providers, dietitians, nutritionists, and if not treated appropriately, these changes or these problems can extend throughout the life of that individual patient.
Are a lot of those charges covered? In other words, you know, that sounds like a kind of expensive treatment process, but can you get help with this through your insurance?
These are established diagnoses. These are mental health diagnoses that carry weight with the insurance providers. Always speak with your own provider, but in many cases, these are established diagnoses that receive treatment just as you would if you had diabetes or hypertension.
Got it.
It's really such a difficult, complex thing to deal with, especially for the parents with you know, children who are dealing with this. For a long time, there were not a whole lot of resources in a lot of different towns. Are we seeing better facilities to treat things like this?
Not only are we seeing better facilities locally, because you mentioned even the online presence. There's so many different outreach support groups available online. There are national associations devoted strictly to this cause, raising awareness this week alone.
We've got the number up too to get help if you need it.
So there's a lot of resources available, and people need to really, if you are concerned about yourself or a loved one, please reach out, because you cannot solve this on your own.
Do we make mistakes? Do we say the wrong thing? What are the wrong things to say to someone if we're trying to reach out and help them? Well,
first of all, you can't tell someone has an eating disorder just by looking at them. In fact, one study said over 70% of people with eating disorders are actually obese. And in many cases, this is not an attitude or a thing where people are doing this to get attention. This is not attention-seeking. Many times, people are covering up. They're wearing baggy clothes. So bringing that attention to the appearance sometimes can be a little bit jarring and cause people perhaps not to seek help.
Is there always an underlying issue when it comes to, especially with anorexia and bulimia, that there's something else going on that's causing them to do that? But not all cases.
Not all cases, but in many cases there can be associated mental disorders, there can be obsessive compulsive disorders, there can be control issues, there can be trauma perhaps there's recovering from. So that's why you have to have the mental health providers as a part of the treatment team as well.
We appreciate the insight. It's very important to raise the awareness. Thank you.
Thank you.
Thanks, Dr. C.
You're watching Carolina's Family at 4. We'll be right back.